Recording in progress.
Good afternoon, Geraldine. Welcome to this series. This series is mainly to encourage our Indian nurses, and I know about you very well. And for our viewers, I want to explore more about your experience, and I want you to introduce to all our viewers. Can you explain about your professional experience? How many years of experience you have? So, would you like to explain about your what are the things you have done contributed to nursing?
Mhm. I'm many years ago in the 80s, I trained as a registered psychiatric nurse, and then I did my general nursing stuff afterwards, about a year and a half later. And I worked in general and I worked in psychiatry. And then I returned back to psychiatry again. And I was very lucky. I worked in acute setting and then worked in community and got the opportunity to do a master's in cognitive behavioral therapy. And that really influenced me in terms of my practice as a mental health nurse. So I had many years working in both individual, working as a clinical nurse specialist, working with individuals and with groups. And I worked actually across three teams. So really, that was the majority of my career in mental health, which I really enjoyed.
Okay. Okay, so I remember the days we met. I think, if I'm not wrong, 2009 or 10, I think
Mhm.
2009, when I was in my community, I mean, home care team kind of thing. So I happened to meet you for some research collaboration and everything.
Yeah.
So since then, we started joining for many projects. And
Mhm.
wherever my name is there, or wherever your name is there, my name is there also. So I'm so happy about it. And even in personally, you helped some of our family members to overcome their difficulties and challenges. So thank you so much. And it's good to reminisce all those things. So currently, maybe seeing people. I mean, like throughout your experience, you said you have seen lots of people.
Mhm.
So I'm just wondering, as a clinical nurse specialist or therapist, as a therapist, how do you find yourself? I mean, what are the difficulties? I mean, let us start with the difficulties, then we can go into some other experience. What are the difficulties you have faced? Most of the difficulties you faced in your professional and career as a therapist.
I suppose, working in mental health, it's a kind of a double-edged sword because people are coming for help, and yet sometimes they're reluctant to take the help. And I'm just thinking from the top of my head, I worked for many years in Vincent's Hospital in the eating disorder service there, and patients were very ambiguous about coming forward for treatment because obviously, if somebody has an illness like anorexia, one of the fears they have is putting on weight and not being able to stop putting on weight. So although you're desperately trying to work with somebody and kind of expounding the reasons why they need help, they, on the other hand, have limited insight. And in the same way, for somebody with depression, the motivation to get better can be very low, even though they want it. And the
Mm.
same with anxiety, you're asking them to face their fears or look at their fears or examine their fears. And as with all of us, we're reluctant sometimes, if we're fearful, we're reluctant to address things that cause us fear or anxiety. So I think being a mental health professional, it's one of the hardest things we face. Our clients want help, but are very worried and very reluctant to take the steps maybe that they need to.
Yeah. So yeah, I mean, as a man, I mean, I mean, like keeping that in my mind, because I worked in the community setup, whereas day hospital. So where, if I'm not wrong, you may be remembering the days where one of our service user was not engaging, not at all answering the
Mm,
phone call, and we
yeah.
tried all the ways.
Yeah.
So in mental health, as you mentioned, this is a really a difficulty. So
Mm.
how do you get connected with MDT? I mean, like in MDT, as a therapist, what is your role? Like, how did you contribute? I mean, in case like somebody is not compliant or somebody is not seeking help,
Mhm.
and how have you ever done anything specific as a therapist in your MDT?
Yeah, I suppose working within an MDT, your main, I suppose, role is communication.
Yes.
And I think it's about communicating the difficulties you're having, but also maybe also saying what you're doing to address those.
Hmm.
And I suppose I'm thinking in a practical example, like somebody who has a fear of, I don't know, um, closed spaces. That for as a CBT therapist, I would have done a lot of behavioral experiments, a lot of exposure work. So I'd explain to the team the stage that somebody was at, how they were responding, and how I would hope for them to
Hmm.
move forward, and how I would continue to maybe work on what I'm doing with them.
Yeah.
And I suppose outline really the goal of the therapy, where we're aiming towards, and more importantly, telling the team what the goal for therapy for the patient is. It's not my goal; it's their goal. Do you know?
Exactly. Exactly. Um, and I mean, like, when you in your early days as a therapist, so I mean, like, I know we always advise the people, I mean, students or junior nurses or the nurses new to their career. We always advise them to be neutral. What is that? To be without any expectation or anything.
Mm.
So, how in your early days? How did you get into your therapist role? And definitely there must be because when I started seeing patients, I mean service users one to one, I really had a doubt myself what I was going to talk to them like, you know.
Mhm.
So
Mhm.
and then I learned I needed to be neutral, and the service users themselves will lead the session,
Mhm.
like, you know.
Yeah.
So how was your experience like?
Yeah, I suppose, my kind of stance has been one of curiosity. I'm curious. What makes you think the way you're thinking? What makes you do what you're
Mhm.
doing? What purpose does it serve? So I would go in with very much tell me what's happening because I don't know what's happening.
Exactly.
And certainly I would always say to the patient, you're the expert with the
Yeah,
difficulties you're having. I'm not. But I have skills, I have ideas maybe that could help, Yeah.
yeah. No, I totally understand. They are the experts. The person who is suffering
Yeah.
from the problem, they know
Yeah.
how the pain
Yeah.
is and everything. And
And
so,
sometimes, sorry, okay,
yeah,
sometimes it can be very empowering as a therapist. You can honestly say, if you're not ready to do this work, that's okay. You
yeah,
can come
yeah,
back again at another
yeah.
time. It's not that you have to come right now at this time. So you're empowering the person to make the decision,
Okay,
and allowing them as much as they can do it, you know?
okay.
Yeah.
I mean, nowadays and recent times, I heard not only in our service and different services, I heard there was some violent activities in one-to-one, so during one-to-one session, like maybe between the therapist and the service user. So, have you ever had any such experience, bad experience during your tenure?
I can honestly say no.
No. Okay.
No, there's times maybe I'd have to make the decision, around kind of putting pressure on somebody and saying, maybe just leave that for the moment, or they're not just able to do it, or
Okay.
whatever, but I have never had that experience,
Okay. Okay. So
Yeah, yeah,
maybe maybe you must have done some kind of risk assessment before seeing anybody. Maybe that
yeah, yeah.
definitely helps
Usually,
you.
you do a full assessment before they
Yeah.
start therapy to assess really their readiness for therapy, to see what their goals of therapy are, and
Yeah.
basically to get a sense of can you help them or not. I may not have the skill set to help the person. So
Yeah.
from that, you fairly good idea,
Yeah.
of what, they're
Uh,
they're
yeah.
like.
And I remember we used to go through your outcomes every year.
Yeah,
So mostly I would say 60 to 70 percentage of positive outcomes and some neutral outcomes. That means
yeah, yeah,
uh, and then so how I mean like even in, I mean like these many years of experience, average of how many sessions a service user may need to guide themselves. I don't say get well because it's a
Mm,
recovery is their life
yeah,
journey, like
yeah,
So
yeah.
how average of how many sessions do you have with any service users?
On average, I'd say about 20, and that would
20.
be the very highest now. But you're
Okay.
talking about maybe 8 or 9, 10 would be,
Okay.
you'd be expecting to get some results at that stage.
Okay.
Do you know? Yeah,
Yeah.
yeah.
Another interesting question. So, I mean, like coming from Indian background, so we always believe mental health, the rich people may not be suffering from mental health or mental health
Mm,
difficulties.
mm,
So, but in during our experience, we have seen a lot of people going to high level of professional works and everything.
mm,
So,
mm.
what is your stand on it? I mean, like, is there any does socioeconomic background play a role in their mental health?
I think it's a very big question. I think that, like what you say, mental health it doesn't have any particular type of person that it hits. And I think that it's very, very unique to the person that has the difficulties. It could even be a stage in their life where they've
Okay.
had no problems up to that point, and suddenly things start to be problematic.
Yeah.
And maybe that's because at a certain age in life, we start to reflect on our life. We know we've only so much time left, and we look at it and think, could I have done things better? Could I have done things differently? There are things I've done that I shouldn't maybe have done, or indeed there's things I've done that I haven't done
Okay.
and have regret for that, do you know?
Yeah.
And you touched on success, okay, if I'm very wealthy, you
Mm.
might say, well, how come I'm not happy? How come I have depression? But maybe having all of that is responsibility. And
Yeah.
maybe that's a worry. And maybe it's a worry sometimes when people are very wealthy. The reverse happens that they get very afraid they might lose it,
Yeah.
or they get afraid they mightn't ever have enough. And they go into
Mhm.
that scene of making more money and making more money. So it's a funny one. Human nature is very complicated and complex,
Yeah.
do you know? Yeah.
Have you ever had any? I know you will maintain your professional confidentiality. You will not reveal person identity. A simple question, yes or no. Have you ever had to do with sessions with any celebrities or any specific, like popular people for your therapy, Geraldine?
No.
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 Okay, nobody. We may not know. We may not know. Like maybe
Yeah.
after the therapy, they must have gone, or but
Yeah. Yeah.
definitely we have seen a lot of people with singers and boxers and all these kind of people.
Yeah.
Yeah,
Yeah. Yeah.
that's fine, Gerald.
Certainly, certainly no celebrity, but certainly very wealthy people, business people who would be very, very successful,
Okay, yeah, yeah.
who on the outside would appear to have everything and aren't. Yeah.
Yeah. So, I mean, like again, mental, I mean, now, same like European countries, in India also, we are getting awareness about mental health and we need to seek help for mental health and everything. So, what is your advice or suggestion for any individual person I mean, what to say, to get rid of the stigma about mental health?
Mhm. Yeah, I think that we're still a long ways from the ideal. There's still a huge amount of stigma.
Yeah.
But I do think that the more we talk about it, the more we realize that everybody has mental health problems at some point in their life. They may not ever be in hospital. They may not ever see a psychiatrist. They may not ever see any therapist.
Yes.
But sometimes it's enough to go to their GP, their doctor, and just talk about how things are and maybe get some kind of help, either practical help or even just that support of being heard and being listened to. So I don't think anyone can go through life without some mental health challenges. I think we're foolish if we think that.
Yeah.
And sometimes it doesn't have to be the psychiatric service necessarily that can help us, you
Yeah.
know. And in terms of the stigma, I think that people are talking more about mental health, there's more conversations happening. And I think from that, the better understanding and people can say, well, I felt like that and it's okay, it's all right. And it's a lot of reassurance about that, you
Yeah.
know?
I mean, like the burning questions with any of our people is, why should I suffer? Why should it happen to me? Why only it happens to me? That kind of questions.
Mm.
So, what causes the mental health difficulties? I mean, I see even myself. I was studying very well, and everything was going well. Suddenly, I stopped going to school, and I suffered like juvenile truancy, or I suffered with some anxiety, depression, or something like that. So even to, I mean, I've seen many people like that. They had a good life. Suddenly, everything goes downhill.
Mhm. Mhm.
And what causes the mental illness, Geraldine?
Well, I think it can be a variety of things,
Yeah,
but certainly it's very interesting. I often say to people, when people say why, and I
yeah,
say there is no point in asking anyone why, because they don't know the answer.
yes,
But the what questions are much better. What's the reason that you feel that way, or what's the reason that this could be happening? And I suppose that we know sometimes it doesn't have to be a big thing. It can be maybe that, you're not sleeping well. Sleep is a major cornerstone of mental health. If we don't sleep well, everything is affected. Our physical well-being is affected, and our mental health as well-being being is affected. So sometimes it's not just one thing, or it's not just big things. Like I often use that. I love analogies. And I often say to people, if you've ever gone walking and if you have a pair of sandals on you and
yeah,
a little stone comes into the shoe, it's
yeah,
really annoying. But it's really also very interesting because some people will keep on walking even though they feel uncomfortable. And
yes,
other people will immediately stop and get rid of the stone. And the question you need to, the question you might say, well, why would one person remove the stone and why wouldn't? But a better question is what makes one person stop and take the stone out of the shoe? And what
mm,
makes another person keep walking even though they're uncomfortable until nearly they have a blister on their foot? And
okay.
it's really interesting.
Yeah, it is interesting, Gerald. And I remember when myself, yourself, and one of our other colleagues, we joined together. We constructed a curriculum for psychosocial intervention.
Mm,
I learned a lot of things from both of you, and especially people say, what is impossible, but instead of
yeah,
saying impossible, you say I am
yeah,
possible. And
yes, yes,
then
yeah,
when people said about illness, and it's remove I and say we,
yeah,
wellness,
yeah,
So there are a
yeah,
lot of things I
absolutely.
learned from, and
Yeah,
then reflection. Everyone's life has a different story, and we
yes,
learn from them.
yeah, that's right. Yeah.
So it's interesting. Geraldine, I have lots of things to talk to and explore from you. Maybe I'll come after a few minutes. Is that okay?
Yeah, perfect. Yeah, perfect.